muscles are different than everybody else's, how they're working. But what I found has been really beneficial, especially for that early foundational myo, is more of a family centered.
Hi, and welcome to episode 341 of the Untethered podcast. Today, we have Ashley Dorado joining us. Ashley is the owner and founder of Myo Movement, a Charlotte, North Carolina based myofunctional therapy practice rooted in collaboration, compassion, and comprehensive care. With over 15 years in the dental field, starting as a pediatric dental assistant, then practicing as a registered dental hygienist, and now leading her own therapy practice, seeing clients both in person and virtually, Ashley brings deep clinical experience and a personal passion to her work. Her daughter's early feeding difficulties and tongue tie diagnosis sparked a transformative journey into airway health and whole body wellness. Today, Ashley specializes in identifying the root causes of oral facial dysfunction and empowering kids, adults, and families through education and evidence-based therapy. She's a Munchie certified practitioner, Buteyko breathing method instructor, and certified personalized nutrition practitioner. She's also completed advanced continuing education in TOTS training, advanced airway circle training, and is currently pursuing her certification as a COM. In addition to her clinical work, Ashley serves as an adjunct dental hygiene instructor at a local community college, teaching both nutrition and chairside clinic. She loves supporting others in their professional journeys and is proud to be a new mentor for fellow providers through the Myo membership. Outside the office, you'll find her exploring Charlotte with her husband and her daughter, still searching for the perfect New York-style pizza. Welcome to the Untethered podcast. I am your host, Hallie Bulkin. I'm a certified myofunctional therapist, feeding specialist, podcaster, business owner, and mentor. This podcast is all about getting your questions answered and collaborating with colleagues to bring you the most up-to-date information in the orofacial myofunctional therapy, airway, tethered oral tissue, and pediatric feeding therapy space. If you're new here, I challenge you to keep an open mind and join my mission to spread this message far and wide. If you've been around since June 2019, thanks for being a loyal listener. As we jump into today's episode, remember to listen with correct oral rest posture. Tongue up, lips closed, teeth apart, breathe through your nose. Let's get started. Hi, Ashley. Welcome to the podcast.
Hey, Hallie, thank you so much for having me. Really excited to be here.
I'm excited to have you here. I know we were just chatting a little bit beforehand, and with you being a newer mentor inside of the Myo membership, I feel like it's all like kind of coming full circle. And you were talking about how you used to listen to the podcast when you were traveling, and I'm like, I love hearing that, and I love having like a listener, but also now a team member, on the podcast. So thank you for joining me.
Definitely full circle moment for sure. Like I couldn't be, this was like your Untethered is the original podcast that I started with and I've continued with. And just to be here really means a lot for my career and just how things have progressed and being part of the Myo membership. So super happy to and now know you and be able to call you a friend and colleague is just incredible.
I love that. I love that. So tell us, for our listeners who are maybe new to you, maybe they're not part of the Myo membership, I know you have a business as well, which we can talk about, but you basically went from dental hygiene to being an airway advocate, right? And so like you have your own Myo journey. So I'd love for you to share with our listeners a little bit about your background and kind of just, how you got into doing what you're doing now. Cause it's not where you started, right?
No, definitely not. And even if you would have told me 5 years ago that I would have my own business, I would be like, in what? what am I doing? So it's been quite the journey, but I originally started as a pediatric dental assistant, fell in love just with dentistry, all of the things, went to hygiene school. So registered dental hygienist. I've been a hygienist for over 10 years. So working private practice. And then right when I had my daughter, I was able to transition into teaching at our local community college for hygiene. So really just education. And that's always been a big passion of mine, just really lifting others up. And then really having my daughter is what tossed me down the rabbit hole. We always say that, and it's such a rabbit hole, but of airway and myofunctional therapy. So with our personal journey, I had her and she was actually an emergency C-section. So didn't go as planned and kind of went down a really difficult time, a really difficult struggle breastfeeding, difficulties latching, reflux. I wore black for 10 months. Luckily, I love black. But it was just, and we were told, and love our pediatrician, but, told, okay, well, this is normal. All of the things we hear. And as, my dental background, I'm like, no, I know she has a tongue tie, which people confirmed, different specialists, but they'd say, oh, it's mild, no issue, this is normal. And it is isn't normal. So I really started doing my own research and just kind of saying, like, no, she shouldn't be sleeping with her mouth open. And all of these things just really took me down. And I just fell absolutely in love with being able to look to the root cause and to really address things at a young age if we can. As we know, it's not too late for adults. But yeah, so after having her, really went all in. And then it's been 2 years now that my practice, Myo Movement, has been open. So owner, founder, Myo Movement here in Charlotte, North Carolina. And we also see virtual clients as well. But it has been the best whirlwind.
I love that. I love that. And it's so exciting. It's exciting to take like what you're super passionate about. Thank you. Like I always say to my kids, thank you for, throwing me down these rabbit holes like you were saying. And it's
Mhm.
very interesting too, because if you had asked me 10 years ago, like what I would be doing now, I could never have told you that this is where I'd be. I mean, 5 years ago, 5.5 years ago, when I was like conjuring up like what I wanted to do in the online space and launching this podcast almost like, was that 6 years ago now, 2019? Like, holy cow. Yeah, it started as like Myo Airway and tethered oral tissues. So I was like, there's just nothing's out there. I went to look and I think there was like one guest episode, right? Somewhere. And I was like, oh my gosh, like we need to be talking about this. And then I integrated in the ped feeding thing because so many of us were having babies. And as like an SLP, I was like, okay, I've done a lot of feeding up until that point with like toddlers on up, but I was not working a lot with infants. I was by the point that I had started the podcast, but not like back in my feeding, my earlier feeding days. And yeah, again, my own kids, exactly like you said, like they kind of just threw me into this rabbit hole. I specialized, my business became more specialized. I launched another business that was around that. And it's just become such a passion project, like you were talking about with like the holistic health and kind of finding like the root causes of things, right? Focusing on that, I think is just, I'm hearing more of it happen now, which makes me really excited. But it was not the conversation that was happening 5, 6 years ago at all. Like it was rare to find somebody who was having that conversation, and it was like pretty much all offline. So yeah, so I get really excited when I hear other providers share their stories. So thank you for sharing that with us. And you
Definitely.
also co-authored an article on like the benefits of xylitol, right, back in 2013. So will you tell us a little bit about that and like what did that do for your career? Like, did that start down like a holistic pathway for you? Were you already there?
I think it was, yeah, and that seems like ages ago, right? I was just about to graduate hygiene school, and I had the opportunity to write co-author The Benefits of Xylitol in Dimensions of Dental Hygiene. And it was a really special, I remember when being broached, to publish, to co-author an article, I kind of had free reign on what subject I wanted. And I love nutrition. I love the Nutrition for Dental Health course, and really became so interested in the benefits of xylitol, really, and just how incredible, when used properly. And that's where the idea kind of spurred, of just this idea of how can we prevent cavities. And once again, I was not even thinking about mouth breathing at that time. But that's what kind of continued that conversation. So, of course, deep dive into research to make that article happen. But it's so funny, once again, talking about full circle moments, because for a while, I actually forgot about that article until this kind of came up. And I recommend, the clear nasal spray to so many clients, which has xylitol in it. And that's, was a big part of the article of how we can incorporate it into our daily lives. And I'm like, oh my gosh, like I think this was meant to be. Like I always was a big fan of finding, not looking to the medication the first route, looking for, how can we, right, keep our nose clean. Now we talk about nasal hygiene. Even right years ago, I would have been like, what do you mean nasal hygiene? Like we talk about oral hygiene, we talk about
Yeah.
teeth, not our nose. But yeah, it's been really cool now. And I need to get it like hung up and framed, because it really is a special part of my journey, and just how that's really continued to grow, with the holistic, for sure.
Yes, I totally second. You got to like get that blown up,
Yeah.
framed, put it on your wall,
Yeah.
put it in your waiting area. If
Yeah.
like you have people coming in, they can see like, oh, Ashley's name is on there. That's
Right.
cool.
Yeah.
She's my myotherapist.
Yeah.
That's super cool. So now, in addition to all of that, and you mentioned this kind of a little bit, but like you teach, obviously you're mentoring, just kind of growing the field in a sense. And so Talk a little bit about the nutrition side because you mentioned that. And so, are you currently teaching nutrition courses? Like, what does that look like for you?
Yeah, so this fall semester is actually starting sooner because it's almost August. So, come fall again, this will be my third year teaching nutrition to our dental hygiene students at CPCC, and so yeah, didactically am able to really kind of, now that I have all of my, myo awareness, incorporate that into nutrition, which has been such an honor to really help these young students have that more of that myo eye that we talk about. So, that's not what they're going to be tested on of their boards, of course, but I am able to fold in myofunctional, work and what it means with when we talk about mastication, when we talk about all of these things. And all hygiene students know digestion starts in the mouth, and that's kind of it, or salivary amylase. Those may be the two kind of takeaways, right? But there's so much more to that. It's using our jaws how they're intended. It's looking for tethered oral tissues. It's when we see them in clinic, their patients. Okay, we see the scallop tongue. What questions should we ask? What else should we look for when we see that? So yeah, being able to be an educator at the college and for nutrition. And I'd say it may have been a year, but it may have been in the fall. Once again, the time warp of being a mom and a business owner. I was certified by the ANA, the American Nutrition Association, with my CPNP, so certified personalized nutrition practitioner. So it's given me a little bit more of scope of practice to support my clients through my practice, but also at school with teaching. And then, of course, as we know, what we do is so important with collaborative care. So referring out. So I don't do, full nutrition screenings, but I love, now I can feel a little bit stronger when talking to my myo clients, but also with supporting my students as well through the nutrition piece.
I love that. Again, I feel as like things come full circle because you're talking about even just with mastication, like understanding the differences between the different foods that we eat, how they support our body, but not just like energy wise, but how do they support our jaw? Like you were mentioning, different foods for the jaw, and not that you didn't mention the foods, but just kind of talking about like what are we eating? How does that impact our muscle and bone structure and all that fun functional stuff? I think that's again a topic that is not so hyper discussed, but is so critical and so important. And I feel like every time I share like the Weston Price Foundation, people are like, the what? And I'm like, oh my gosh, you've never heard of this? Like, go Google Weston Price. Like, like you're just going to go down a rabbit hole. Have fun.
Right, right. Yeah, reach back out in a few days once you've absorbed as much as you
Yes.
can. But yes, it's so, and then too, it's like being able to plant these seeds and breadcrumbs, right? Like the students that I work with, they're not always all going to specialize in myo. Good, that's fine, but they need to be able to screen. And
Yes.
that's where the difference. And I joke, as far as like a hygienist, cleaning, doing a scaling and root planing, we call it a 7 millimeter pocket, isn't fun to me. But educating on the need to take care of that periodontal disease and then get them in the right hands, that excites me. Same with myo. You don't all have to become, specialized as far as we do, but you need to be aware and get these patients, these clients into the right hands.
Yeah. Yeah. 100%. I think it's so critical, but that's why I love this whole conversation. So now you also kind of started to talk about like the team approach, and how it really takes a team. So talk to us a little bit because people are always wondering about this. When you launched your private practice, did you already have a local team, or did you have to like get to work and find those people to collaborate with in your area?
Yeah, I would definitely say more so the latter. We are fortunate enough in our area, we have an awesome Myo study club. So I started going there, which was a great, start to kind of continue the conversation like we do here. But then really when, I opened the practice, it was reaching out and kind of going to different potential, whether it be dental offices or, speechies, as we lovingly call your silo, ENTs. I really, myself and an orthodontist in the area and a general dentist, who she's also a myofunctional therapist, we set up a meeting with a big ENT group in our area, and it was like hitting a brick wall. It was really actually frustrating. And it was funny because they had tried before, and I was like, no, I think now's a good time. Hit a brick wall, so we kind of pivot. We're able to find a really great, ENT in our area as well. So definitely a combination of having to build up the providers that really that we trust each other, right? We can pick up the phone, we can text each other now and say, hey, Sally's coming to you, keep an eye out, or what do you think about this? So yeah, really trying to though continue that growth and not just keeping it, let's say, to the dental world or to ENTs, but making sure OTs. I've done a lot of, I do like a Myo and muffins is what I call my lunch and learn. But so I'll go to different practices that are, really open to looking to that root cause, and am part of a holistic think crunchy group in the area, which is really, I hate the word like-minded, but I love it because we are like-minded but open to things. So I prefer more open minded with the same kind of resonance. And so I've really been able to continue to build from there. And even just, client recommendations, client referrals, word of mouth has been. So when they come in, I find out who their team is, right? Who their primary care is, if they have, a speech therapist, if they have, who their dentist is, orthodontist. And then we'll send out our reports, to those providers. Some may read them, some may not, but it's been really great feedback because they'll respond. They'll say, hey, tell us more about this myofunctional therapy. What is it? And then that's a great way I would recommend, new or even, currently practicing, to continue to send those reports. And even if you think that they won't read it, they may, and just getting that word out.
Yeah, for sure. Um, the reports thing, I always like laugh because I'm
Oh,
like, we spend so much time writing these beautiful reports for people to not even look at them, right? So I always, I'm like, if you can bullet point, if you can make things shorter, people might actually scan and read more of it, right? So it's, yeah,
it's been a lot. I know I used to have just bright pages. Then it's like,
yeah,
oh my gosh, but I want them to know. It's like, but at least let's get them to read something, right? They're not
yes.
breathing through their nose, but I know definitely a love hate with reports, but
For sure. For sure. And then, I think we kind of talked a little bit about this like briefly, but like just the gaps that are out there, right? I mean, even just the silos that we treat in is kind of a gap still, because not that we treat in, but that most of the medical community treats in. Definitely looking at traditional care versus like the approach that we like to take, which is, more holistic. But there's other things too. So have you run into in your private practice, like have you run into other challenges, or, I know like my private practice is private pay. We don't take
Mhm.
insurance. We do give super bills parents can submit on their own. But have you run into like anything else? Are there other gaps that you've exposed, if you will, and, in your time in practice?
Yeah, I find so our practice works the same way. We are right fee for service, offer super bills. But what I like to remind clients is that, myofunctional therapy, like I'm not supposed to see you forever. Once we get the muscles working for you and we're able to facilitate that, great. I'll come to your baseball games, tell your friends, but I don't want to see you in my office forever. So I find that that's been a way to talk to, whether it be adults that I'm treating or, kids or families, is reminding them that this, yes, it's an investment in your health, but it isn't a forever recurring cost. But really, once people can see and start to feel better, that usually goes out the door. So I'd say, kind of like initially, there may be, well, why don't you take insurance, things like that, but it does tie our hands. And if somebody, and hopefully, accessibility does become more of a part of this. So that is definitely something that, as my practice continues to grow and as my journey continues, I really want to look to accessibility and being able to open that doors. But there are some providers in the area that do take insurance, code it the way they need to code it. So I just refer those clients, if that's their number one priority, that's where I send them, and that's great as well. But really trying to continue to bridge the gap between, right, modern medicine, and even, once again, I'll talk about ENTs again, right? We're doing a lot of tonsillectomies, removing the adenoids, which is certainly, beneficial at times. Surgical intervention can be necessary, but if we're not fixing the function, if we're not fixing the mouth breathing, it's gonna replay. So kind of always just educating and reminding the parents, the adults, why they're here and kind of what service we do provide. And it is a specialty, but it's, yeah, not forever is a good way.
This is true. Yes,
Yeah.
it's not forever. And I love that you highlight that because I do feel like, Myo is not meant to be like a year after year kind of thing. Like
Mhm.
as a speech pathologist, like yes, we get kids that come in for many other things and that may be a much longer road and a much longer journey. And sometimes Myo is part of that. But
Right.
yes, for our traditional Myo cases, and honestly, when I added Myo in, I was like, oh, this is such a change. And it's kind of keeping me on my toes a little bit because I was only working with pediatrics and then I added in adults and the adults moved so much faster. Like I was like, like even the frequency with which I was seeing some of them was different than the pediatric cases. And, their total time in therapy was different. And just because of cognitively, right? Like adults get in, and some adults had different goals than others. Some were like, I want the whole kit and caboodle. And other people were like, I'm just here to make sure my problem doesn't worsen. I want to
Mhm.
just like maintain where I'm at right now. And so, just kind of meeting our clients where they're at. And so it was very interesting to like kind of get out of that like day to day for me of practicing with my, feeding kiddos or my speech language kiddos into the Myo world because I was like, oh, okay, this is a little different. And there's a lot of overlap, but like you said, it's not a lifetime thing.
Mhm.
And honestly, some of the kids who were in Myo for a while, like they had some other stuff going on that was kind of preventing them from partaking in a full on Myo program. And that's why it was prolonged, you
Longer
know?
haul. Right,
Yeah.
exactly, right, and everybody is so unique, and that's where though, right, supporting it with that, once again, collaboration and that team approach. So I love, right, getting the foundations for the kiddos, right? We need to be able to breathe through our nose, have that awareness and just the repetition, the tongue needs to be up while we support other things. And it's just, yeah, the adults have been really, yeah, just I really like working with kids and adults though too, because I find for both ages, regardless, what I think helps me is like symptom driven, right? We really are, because your symptoms are different than mine, then different than so, and your goals, exactly like you said, are different. So really, like with the intake, that's why our intakes are always so long. Not only all of the, specialized, measurements and function that we're looking for, but really digging deep into what the issues are. I've had a couple kiddos that are not only nail biters, but toenail biters. And this is always so, like, both of them, chief complaint, right? That's what they're here for. The parents don't want them to bite their toenails anymore. Of course, with that, we see so many other dysfunctions, right? That's the symptom. We need to get to the root. And it'll say, like, let's say 6 weeks later, I'm checking in with mom, we have an appointment. And I'm like, oh, is Johnny, is he still biting his toenails? She's like, oh my gosh, no, it's been weeks. Like she totally forgot that
Yeah.
that was why they were here because and that was once again symptom driven. We had more things to work on clearly, but it's just really always so interesting to see how different things present. So I know that was a tangent, but
No, but I love you brought that up because I
yeah.
always talk about this. Like, it's funny, back when I first started teaching like Myo myself, I
Mhm.
really was more driven by like eliminating oral habits initially. But at the same time, I was working with patients where they weren't having success in these like thumb sucking elimination programs or nail biting elimination programs. And I was like, well, I'm not going to not do Myo with them. Let's just do it and see what happens. Cause I was taught like you had to eliminate that first.
Okay.
And then
Uh-huh.
I started like, realizing, oh my gosh, these kids that are going through Myo and basically graduating a Myo program, if you want to call it that, are no longer engaging in their oral habits because now their tongue is up, it's doing its job. They have no need for this. Like that. And a lot of times I feel like those noxious oral habits are serving a biological need. They're serving a purpose. So to just try to like eliminate it without actually addressing, like you said, like the root cause, the underlying issue, it's not serving anybody. If anything, it's probably stressing their system out more. Right. And so I will tell parents, like I used to be like, yeah, let's do a thumb sucking elimination program. Like we'll do it for like 10 days. Then we'll start, we're kind of a little overlap with Myo as we start it. But now I've totally changed my tune. And this has now been 3-4 years deep,
Yeah.
but I'm like, nope, let's just go straight into the Myo program where the younger kids, I'm like, it's a feeding program with like some Myo goals in mind
Yeah.
and like watch what happens. Cause like you said, with that kid, like all of a sudden mom's like, oh my gosh, no, it's not biting his toenails anymore. Well, yeah, we no longer have the need to do that. Our system is like feeling as cool as a cucumber and everything's doing its
Regulated.
job.
Exactly. Yeah. And that's so 100% right. That's where my same habit elimination has really changed over the years too. And it's so successful because we still, of course, can talk on that depending, however, but it's not just one thing or the other. That's that collaboration and getting that tongue up. And it's just been, once again, life changing. And it's just, and then for the future too. So getting rid of that noxious habit, but really then just setting everything up instead of just saying like, oh no, like, we're going to wear, all of the things, which can be definitely beneficial, but really getting to the root is where we see that long-term success. Even my daughter, we were able to get her, to with Mayo, that kind of combination. I think she was 3.5, and it was incredible. Like, of course, we know working with our children is different at times. So she will most likely forever be my, proudest habit elimination program because it was, it was my daughter. So, but I feel really good about that and moving forward and her stability and journey with that now.
I love that. I always love hearing that. And it's not easy to treat your own kids. So good job, Ashley.
Thanks. Thanks. That was right. I will
Especially at
never
that
forget
age.
that win. Yeah, that was a big win. Yeah. Yeah.
And all that to say too, I'm not saying like that there's no time or place or need for like a habit elimination program. I feel like what I have found to be more successful is like if for some reason it doesn't kind of eliminate itself throughout the Myo program, like then we can more address it more easily head on once
Yes.
we have like the basic foundations that we're teaching through the Myo program, because now we have those foundational skills. We have the ability for like the kid knows what we're asking them to do. And honestly,
Yep.
adults too. Like I think I read something a couple of years ago. It was like a third of adults are like closet thumbsuckers or something. And I was like, that's pretty high. I had no idea. And so, we say kids, but really adults, like this is for you too.
Yeah.
Yeah. Yeah.
For
We
sure.
can always do it, and I think it's easier with adults, honestly, just cognitively, not necessarily easier to break a habit, but I think with the kids, I was always taught like if you're starting with it, you also have to make them think it's their idea. You got to get the full buy-in. You can't do it during any time that there's any changes happening in their life. Nobody should be
Yeah.
traveling in the family. I'm
Yeah.
like, do you know, like I was working in DC, Maryland, like before I moved to Florida. I'm like, do you know, like these are dual working families. There's always 5,000 things going on. Like finding that perfect time even to do the program, like if you're doing it the way it's prescribed and taught,
Mhm.
is challenging. And then to make sure the child has like no other things changing, like within weeks of like completing it, I was like, okay, this is just, we're just setting these kids up for failure.
Realistic, right? And then that's where marrying it all together, and it's not right. It's not so black and white, but then,
Mm-hmm.
building on, right, the tongue placement, the awareness, get them to start sleeping, all of the things, all the regulation, and then right cranial sacral, even those modalities. And then I feel like that is really when we can shine and see the benefits. So 100%, it's good to like feel that same way as a provider. I'm like, this is where we're seeing the successes without
Yeah.
having to write. We're addressing it, but not, yeah. It's
It's
not the
not
elephant in the
solely
room, but
just
it's
like
fine. Yeah.
focused on that one thing. It's kind of integrated
It's all of
within,
it.
and it's,
Yeah.
yeah.
I
Yeah.
even had a
I love
girl that, once again, chief complaint was thumb sucking. I think she's 9, lovely. But that's why I told mom, I said, yes, we're going to address this, but in order to address this fully, we need to get the tongue up. We need to tongue thrust, things like that. I think it was in like within maybe 3 days it was, but now she was bought in. She wanted to stop. So that of course helped. But then so that, we had a few more appointments. And then finally the daughter, she's like, well, why am I still here? Like
it.
I'm done. Like my thumbs. And I said, yes. I said, but like we need to fix or help your tongue thrust, right? So we still had these dysfunctions, even though that habit was gone.
Mhm.
And once her and mom got that, they were like, oh, okay, yeah, because I showed, what was going on. So yes, we got this down. That was going to be, hopefully the kind of easiest thing. Now we need to really circle back. But yeah, it's always we're complex. It's not just one thing. We're a complex human of different varying levels of function and dysfunction.
Yeah. Well, yeah, we get parents who are like, they come in because the kid is, having a hard time saying certain sounds, right? So they're focused on the articulation. And we're like, it will be a lot easier to address the articulation when all of the muscles and structures are
I
doing
know.
what they're supposed to be doing. So it's getting their buy-in, right? It's like getting them, because and honestly sometimes I'm like with certain families, I'm like, we just got to start with the speech. Like we'll start with it alongside the Myo. I'd love to get partway through the Myo program and then introduce the sounds, because then I know the tongue's going to be in the right position, or we'll be able to train it and teach it to be in the right position, like versus like undoing the compensations that they're going to be using if we start with it out the gate. I'm like, but sometimes it's just meeting the families where they're at and like their motivation level, right? And like if
Yep.
that's the chief complaint and you're gonna lose them altogether because they're just like, this is not what I signed up for, right? It's
Right.
like we have to totally meet them where they're at. And the education piece I think is huge. And so I'm like, I'd rather them like start working on one sound and kind of let them know like I hear you,
Yes.
and then we're like wait for the rest of them until we're like a month or two into the program. But yeah, it's always fascinating. And so I
Yeah.
love that you kind of brought up like listening to the chief complaint too, because I think like we have in our mind like what's the prescribed way that we would like to go about this with each
Mhm.
patient, right? And everybody, like you said, comes in with different signs and symptoms and chief complaints. And, we could very easily prescribe like our idea of what their program and what their goals are,
Right.
which, as medical professionals, we do that,
Yes.
but also adapting it and meeting them where they're at, I think is so important. And I keep like, without you like really saying that, that's basically what you're saying, right? And I think
Exactly.
it's so
Exactly.
key because
Yeah.
people always ask me, they're like, well, how do you have like such success and how do you have your patients, like how do you keep them coming back and how do you have such a high graduation rate from your myo, with your myo clients? And I'm like, are you listening to what they're telling you? Like, I mean, we know what we've learned in our courses. We know if we're certified what we've been taught and mentored on. We know what an ideal program might look like and therapy might look like. But if I have an adult telling me, you know what, I don't want to do all that. I just want to make sure that my jaw sliding doesn't get worse because it's upsetting my TMJ. Can you teach me how to compensate better? Or can you teach me how to just like, you know, get me to a certain point? And like, and they're very clear, like, this is why I'm here. This is what I want. Do I love that at the end of the day for me? Like, I'm kind of like, I'd love to take you through the whole thing, but I'm like, that's my ego,
Right.
right? As
Yep.
a medical professional, my goal is to help you, help yourself. And, sometimes those people come back and they're like, okay, can we do more? Right. But that's their own journey. And it's like, that's them coming back and saying, okay, now I'm ready for more. And sometimes they don't. Sometimes we get them to where they want to be and they're perfectly
Feel
happy with
great.
that. And
Yeah. And
yeah,
they still tell
yeah.
their friends. They're like, Mayo's amazing. I'm like, oh my gosh, we didn't, but that is so true. And even just like, to from the dentistry side of things, I think a lot of like hygienists, dentists listening to this will resonate is like, we have the patient comes in that just wants whiter teeth, right? And then we take the x-rays, we do the assessment, and once again, gum disease or high risk decay, we still want to fix and address what we know and educate, what we see, but we also still have to hear them and listen and make sure like, gosh, well, if you're brushing better, if your gums are healthier, your teeth will look whiter, so that's
Mhm.
already a quick flop. So it's that psychology of it, which I think I love the myo part because it really right, it's not black and white. What we learn in our courses, we are so unique. So incorporating that psychology and just listening and then exactly putting our ego aside and getting them to where they want to be with continued right support and saying, gosh, well, I am still seeing this. Maybe they want to continue and maybe they don't. But yeah, I absolutely love that. So totally.
So, talk to us a little bit more about your practice. So, Myo Movement. I know you kind of talked about who you help already, but like who you help and how you help them, and what I'd love to know more about because I know you've talked about working with kids and adults, but I think that you've mentioned that you sometimes will integrate like a full family therapy. So, will you share and you can share anything you want about your practice, but will you share a little bit about that because I think people will be very interested to hear about how you go about that.
Yeah, and I think too, once again, different Mayos have, we all have our own kind of thing, right? And some may be more rigid, like only one, family member in Mayo or habit elimination at a time, things like that, which I get. I totally understand that because myofunctional therapy is personalized. So it is, our muscles are different than everybody else's, how they're working. But what I found has been really beneficial, especially for that early foundational myo, is more of a family centered. So if a parent reaches out to our practice and they have, let's say, a 6-year-old and a 9-year-old, one's still wetting the bed, one's biting their fingernails. So they both already, we kind of hear the red flags, right? We're looking root cause, most likely airway. So, we do separate evaluations. Usually it'll be at, similar time, but once again, I want to get the pictures, the measurements, so we know exactly what we're working with both and then kind of get an idea of what to work for. But then really it's saying, and you can always see the parents sitting there too, they're like, gosh, like they're trying to move their tongue or seeing their issues in their children. So I really say, instead of making this a battle to get your 6-year-old and your 9-year-old to do this, do it as a family. Like we'll have, some of the exercises, especially in the beginning, just getting movement, just getting more range of motion, just getting that buy-in and that repetition with the brain. Do it at the dinner table, whether it's before you guys clean up, everybody sit there, dad, mom, whoever, just do your clicks and TikToks, just make it less of a burden on the child and a burden on the parent. Like we know it's tough having young children and just to add more therapies on. But with Myo, what I love too is it doesn't have to be perfect. It doesn't have to look perfect. Yes, ideally, if we're in front of the mirror or mirroring each other, that's when we'll see faster results. But I'd rather them be doing something than nothing. And I always remind my parents to just talking about we keep our lips closed and breathe through our nose. I have a little like Myo Dino, which was adapted from a Myo Ninja. And I have, gosh, who was it who did the Myo Ninja? OMT of York, Angie. So I have like a Myo Dino that they'll take home and it'll sit around the house. So it kind of works like a code word. So when they see the dinosaur or when the family uses this code word, this means everybody. Are your lips closed? Are you breathing through your nose? Is your tongue up? Are your teeth apart? And I found that those improvements alone by making it more family has been game changing. So that's kind of my family approach. And then we start to see, things progress faster for somebody and we're kind of moving in the right direction, and then we'll spend a little bit more time, so then we're able to tweak it a little bit more, kind of put some in a holding pattern if we need to really focus on this, or if mom is snoring and really wants to hone in on specifics. But that's kind of how my family centered approach works. But right, also with my practice, I see plenty of adults who don't have children, which is great. I see plenty of children who the parents don't see that in themselves. But that's kind of been my way of kind of pulling it all together. And once again, that accessibility. So making it easier, more tolerable financially, time wise, right? Bringing 3 kids the appointment and just kind of really getting those, once again, those foundations. I'm just so big on, because as we know, with the young ones, then their growth and development, that whole trajectory can change by just these, seemingly simple tweaks, even though they're not simple. As we know, there's a lot that goes into it. I think that has just been a really neat way for my practice to support more people and really still get those wins that we want, which I absolutely love. Yeah.
Amazing.
Yeah.
I love that. We definitely had a lot of, or have a lot of like, siblings. And then, like you said, like you'll get the family, whether it's the tongue tied babies or it's the mild cases, you
Yes.
get these parents sitting there and like looking at you and you can tell, like like you were saying, like they're like, oh my gosh, I have this going on too. Wait, can you look at my tongue? Like, wait, do I have a tongue tie? Wait, hold on. I snore. I have problems with sleep, or I'm exhausted when and it's like they start, like the wheels start turning, things start clicking, and you're like, and honestly, when that happens, I'm like, yes, because I'm like, if they're starting to see it in them, they start to realize, oh my gosh, this is already happening with my child. Like, I can get ahead of this so they don't have these issues later on. Like, okay, cool. But I love the whole like family approach, because I do find that it can be challenging sometimes. And I think one thing as a speech pathologist that's tricky is if we see kids together and we're providing super bills, we have to code it as group therapy, and the parents are not going to get reimbursed. But if we see them individually, then the parents will get reimbursed really well for both kids separately. So there's like challenges, right? Like even in a private pay practice, it sends a super, like cements a super bill
Right.
or gives the family a super bill.
Yes.
But so we've always tried to be like a little creative in that too, where,
So
it's like
for
shared
like
homework.
review.
Yeah, like maybe
Exactly.
we're seeing the kids like back to back,
Yes.
and the sessions might, instead of being 25 minutes, it's like a 15-20 minute session for each kid. But then it's like, okay, for homework this week, even though you guys have some different goals, we still need to build foundational skills, especially in the beginning. It's like everybody's working on this, like as a family. So I love that you really highlighted that. And I love that you even see some families together sometimes,
Yeah.
because honestly, I can't tell you how many times the parent is there in the session anyways, right? And sometimes the siblings are even like in the session.
Right, exactly, right. Even right, that's I love that you say that, right. I'm not even like treating like some of them I haven't, right, done, their intake or anything, but the siblings there because they have to be. And
Yep.
sometimes they'll, wait out in the waiting room, which is great, but sometimes they do want to be involved. So I'll give them, okay, here's this. So it's not black and white, and it's just making it work and adapting it. But then really, making sure that we are hitting on everything that we need to, especially past the foundation. So definitely very, not always the right case. And there are definitely kids that, we will either try it and it's like, nope, that doesn't work well. We need to do it individual. But so everybody is very, very different on that. But yeah, it's
Yeah.
it's a neat way. But yeah, once the parents, yeah, they see themselves and they have obstructive sleep apnea. I have one amazing family. The dad came to me first, found my practice, graduated, amazing student, just all the things. And then we were talking in one of the sessions, he brought his wife because she's a speech language pathologist. So she joined us just to see, and she's like, oh my gosh, this is amazing. And I told her about your course. And then they were talking about their three boys, and now they're on each of their personalized programs to graduate. And it's just been so, once again, life changing, and in right, not a 20-year program, in something that is, we see the results. So yeah, it's great to get to know the families and make the difference early if we can, but it's always not too late for adults. So that's what I've really been trying to harp on. Like,
Yes.
if you look at my Instagram, you see a ton of kids because kids are cuter to take pictures of doing the things, right? Adults don't look quite as cute doing some of the things. So some of my adults are so sweet. And I'm like, can I take a picture of you doing that, for Instagram? And they're great. And they are lovely and beautiful. But right, adults, it's not too late for us is a big thing.
Yeah. And I think you and I are both the testament to that because we both have done things and are doing things coming up
Yes.
that,
Yes.
like I know we can talk a bit about your personal journey. Like I'm about to go into MARPE, and it's funny because I was doing Pilates this morning with a fellow speech pathologist, and she is looking into stuff for like her and her daughter even, and and she's not like in the myo space. So she's kind of learning all of this as she goes. And she was like, well, why are you doing, because I'm about to do MARPE. And she's like, well, why are you doing MARPE? Like, you don't think you've had enough expansion? And I was like, no, it's not that. I'm like, well, for one, like I do wake up with a scalloped tongue, but
Mhm.
part of it is because of my like maxilla is turning inward on the left side. I'm starting to get TMJ pain. Like that's all new to me. And I'm like, I want to get ahead of that.
Yes.
I've done DNA Vivos. I got some great expansion. I've done, Invisalign. It kind of retracted me a little bit. I'm going to go into Invisalign again after, but it's a different strategy. And the,
Yeah.
orthodontist that I'm seeing is the one that my kids have been going to. And my 9-year-old, almost 10-year-old is in her third appliance, and this will be her
Mhm.
last one. And my 7-year-old is in her second one. This will be her last appliance. They've each only had one appliance with this ortho. But anyways, I'm like, it's really interesting to see how people use like similar appliances in different ways and the results that they get, because the results that they've gotten are phenomenal. And so I'm like, to go into MARPE after I've already had nasal surgery,
Yeah.
I've done expansion as an adult. I'm like, I'm not doing it for vanity purposes or for like more expand. I mean, yes, I'm going to get a little more expansion, but she's
Right.
like, I only need like, I don't know, maybe 5 to 7 millimeters. It's not a ton.
Right.
But like I was very worried about it. She's like, I was like, what's going to happen to my nose? Like that's my biggest concern, because when I did my septoplasty and my nasal swell body and turbinate reduction,
Mhm.
I had them like basically fix the top of my nose that had like a bump on it.
Yeah. Yep.
And yeah, and I was like, is this going to mess up what I did 3 years ago? Now that said, when I had that surgery, I also developed a postnasal drip that is constantly there. And when I'm in like recycled air situations, like sitting in the car, on an airplane, whatever, it kicks in. So it's like more triggered by certain situations. But anyways, it's constantly there. My husband's like, you're making that noise again. And I'm like, I can't help it. Like I'm gonna
Right.
choke on like the stuff coming down. Like, I'm like, I can't help it, but it's kind of gross. And honestly, I'm over it. So I'm like, it hasn't gone away. I've tried so many different things. It does help if I use clear a little bit, but
Yeah.
also it's not a permanent solution, right? It's kind of more of a
Right.
band-aid in that sense, even though
Yep.
I'm engaging in nasal hygiene and everything. So my hope for the MARPE is that like one, I get the expansion. I don't have the TMJ pain. We get my left maxilla, which is kind of locked up, like in the right place because I've got some asymmetry right now, and my lower jaw, which is actually looks like it's deviated when I speak and when I open my jaw, is actually not the problem. It's my maxilla, not my mandible, which is wild because
Yeah.
everyone just assumes it's my mandible. I'm like, plus the postnasal drip. I'm like, I've got a whole lot of goals that I'm really, really like hoping the Smarpy fixes.
It's
But
good
yeah,
at the end. Yeah.
it's
Yep.
that whole thing, right? And then she will, what she does, because obviously the spaces are created,
Yep.
is she slowly moves the teeth like forward and into place, starting like from the front and then moving towards the back when she uses the Invisalign, so it doesn't retract you, like which is what happened after the Vivos appliance. So, anywho, that's my update on my
I
personal
love
story. More
that.
to come,
Oh,
but
this
but what do
journey.
you have going on? Share with us.
Yeah. So I will be starting aligners here soon. So, right, once again, my story has been so, once again, just we're all so unique. My premolars on both sides, but primarily my right, are loose. They're mobile,
Oh,
which, as you know, I just turned 40. I know we both had birthdays this year.
yeah.
So, the big one, but, no periodontal disease, no, nothing from the dental. I'm like, what is happening? Well, my bite is off. And I've always been a severe clencher and grinder, all of these airway things as a kid, which now my parents, know what I specialize in. And they're like, even like I was a bedwetter when I was a kid and all of these things. And I sucked 3 fingers, like classic, check, check, check. They're like, Ashley, I'm so sorry. I was like, no, like, of course, that phrase that we love, like, we now know, like, you guys didn't know, but now we do. And I'll talk about my daughter's story too. But so I'm now adjusting my bite again. I was born with congenitally missing laterals. So I had a diastema between 8 and 9. And when I had ortho as a kid, right, they just pushed everything forward and then filed down my canines, right?
Wow.
So lots of broken, chipping on the front teeth and a whole journey with, luckily I was in the dental space. So my composites, they fix them and then they break off again. They fix them, so finally veneers. But now I'd say it's probably been at least 2 years since I really started to notice the mobility with the teeth, which is very concerning. So we got a cone beam started through my airway journey. And with Myo alone, my clenching and grinding has reduced, I'd say probably a good 80%, which is from
Wow.
100%. So I'm kind of 20% less, but with the aligners and with a tongue tie release upcoming in a week, actually a week to the day, we're really hoping that structurally now I'll be able to support and get my tongue in the correct resting position without using all of my compensations, which have been, become more and more apparent, just how hard my body is working with the tension, everything through there. So through my journey, my symptoms are really, really kind of an overarching goal is relief, right? Relief from the tension, the pain, of course, stabilizing those teeth, getting those the bite where we need it to be. So I'm very excited about that. And then, kind of at the same time, my daughter's journey, right, which brought me down the rabbit hole. She's been through a fixed expander. She was 9 millimeters deficient when we started as a 3.5-year-old, snoring, bedwetting, whole gamut. Like I said, oral habit, which we fixed prior to expansion, which was awesome. But once we had the change in the structure, it's been a game changer. We're still looking into potential adenoids removal if, once we get the new image to see where things are at there. But she also has, tether tissues, so her tongue and lip as well. I'm also getting my lip. I had it released back as a kid with ortho, but just more kind of for a vanity and to see if it releases a little bit. I'll also do my lip. But so yeah, mine will be next Tuesday. Hers will be the day after. She will be under sedation, IV sedation, because she's 4.5. But I'm really excited for, her symptoms are very low now, which is great. But my concern is the growth and development and the relapse of the expansion that we've got. So it's definitely indicated. And I'm really excited to continue to support that through her And then, so she won't end up like me, and having to do these things. So yeah, our journey is, the next kind of big step is happening real soon. So we've been supporting a lot with craniosacral therapy, chiropractic work, just really making sure that we're, kind of in the best place that we can be. Of course, Myo, right? That goes unsaid, but to support that journey. So yeah, stay tuned.
I'm excited for an
Yeah,
update. You'll have to
yeah,
keep us posted.
definitely.
I basically had my tongue tie released after I had Mia. And as everyone kind of knows, if you listen to the podcast,
I
both my
do.
kids were released, and so it's actually interesting because we tracked Lily, who's about to turn 10 in
Mhm.
August, but we tracked her for a while because when we were doing her second round of expansion, it was kind of like unknown. We were like, does she need another tongue tie release? Like, does she have enough mobility? It seems pliable, the tissue underneath, but like, I wasn't convinced. And as a toddler, she would like gag when she would drink through a straw and the liquid would go straight to the back of her tongue. And I think it's because she wasn't elevating the back of her tongue. Like we released her at 24 months, but she never really learned how to use her tongue properly. And then, through Myo, that improved. But I was like, okay, joke's on me, feeding therapist, Myo mama that like basically has a child who can't even drink from a straw. Like, okay, that's, fine. And they didn't want to release her lip because, even though it looked like it was restricted, they were like, no, we don't think that's the issue. And I'm like, she could round her lips beautifully. It's not causing any issues currently. So we haven't released her lip, but it's like always in the back of my mind because my youngest one was released at 5 days old, lip and tongue. So, it's very interesting to like go through it myself and then to go through it with each of my kids. I feel like all three of us have had very different cases, even though we've had very similar procedures, if you will. So anyways, now we've moved on to gut healing for my youngest child, but in myself. But anyways, yeah, it's interesting how everything just kind of comes full circle. And here I thought I was done with my expansion journey, but I'm
Yeah.
not. We're about to restart it.
Surprise. Yeah,
My
you're
husband's like, you're paying how much to torture yourself,
yeah.
essentially? This looks like a torture device. And I'm like, no, it's not. Everything's going to be great. Like,
It'll be worth it in the end. Exactly,
yes.
right? And two, then, so you can live to your 90,
Yeah.
and without this tension
Without
and
pain and
without
tension. Yeah.
exactly.
Yeah.
So
And
definitely
it's interesting too, because it's actually, you don't even, so, and I know people do it differently everywhere. And I'm about to have Dr. Koval back on the podcast. Like, we're going to do a recording like tomorrow. So that'll be out sometime soon too. But, I guess maybe she does things a little differently because it's my understanding that I'm only going to have the appliance in for like 8 months before and I think I have to go back and look at the timeline at some point after I'm done like cranking it, and she does like what is it, like a episiotomy or whatever it is, the
yeah,
PA's treatment
so we'll go with
where
that.
they split the suture line for you. So I think that kind of speeds things up a little bit in the beginning, and it's less pressure and everything on the cranial bones in the beginning, which I'm not opposed to. The whole thing scares me a little, I'm not going to lie, but I'm not opposed to it. And then it's like after you're done turning it, I think you keep it in for a certain period of time, and then they remove the bands around. So it's still in the palate, but they remove it from your teeth. And so that way it holds the palate while the palate continues to heal. And then I go immediately into the Invisalign to start like moving things forward. And so I don't know if it was the whole time frame is 8 months until they take out like basically the entire appliance, but I was like, that's like nothing. That's like no time at all.
It'll be here before we know it. We'll be talking
I
again. We'll
know.
be like, do you remember when we were on the pod and you were just about to get it? And we said,
Yeah.
gosh, yeah. We'll be like, yeah, that was 5 years.
Uh-huh.
Yeah, it's
Yeah. And the week, like right now, while we're recording this, I
yeah.
basically like we stacked a bunch of podcast recordings for like, I'm like, I'm back from my trip. I'm leaving again on Monday for a week. And then I come back and I go on August 11th, I go right into the appliance. And so I'm like, I'm not going to have clear speech for like a month. Cause I asked her, I was like, you know what I do for a living? I record. I need to be honest with me. I know I can talk, right? After like so many days and my speech will
Yeah,
adjust. But at what point do we think my speech might not sound slushy and super funny? Like,
right.
everyone knows what I do. And this is very on par and like in line with my line of work. So I'm okay recording podcasts with this in my mouth. I was like, but I need to be able to speak clearly and at least have people understand what I'm saying. And she was like, give it like a month. I was like, okay, that's a chunk of time. All
Right.
right.
Let's adjust some scheduling.
Yeah.
Let's squeeze a bunch. No, but that
Yeah. My
you're
team was
right.
like, are you going to be able to talk to us? I'm like, oh yeah, yeah. Like I'm like, I will be more available for you all because everything else is getting cleared out for our entire 4 weeks.
You don't feel that time.
Yeah.
Exactly. No. And And true, like it is great to be in that field because right, people do get it, right or right. Like just but yeah, no clarity needs to come through for the listeners and all the things. So yeah,
I
well,
know. I'm like, if
that'll
someone
be
finds me on the podcast for the first time and I'm speaking and I'm like super slushy, they're
yeah,
probably just, they're not going to stick around.
right.
So I'm like, little disclaimer. I've got this metal thing in my mouth. I sound a little funny and a little different, but here we go. And everyone,
Everyone is
honestly, they're like, when are you getting it? And are you scared? And what is this? And what is that? And they've got all these questions. So I'm like, this will be really fun, I think, to kind of talk through because like when I had my nasal surgery and I documented every single day of my healing for like 6 straight months, like with photos and especially in the beginning, like how I was feeling and how I was healing and all these things. I think that was very like eye-opening to people and they're like, oh, okay, not it's not as bad as we thought it was going to be. And I'm like, no, if you know what to expect, I think that also just kind of like calms your nerves a little.
yes.
And there's for me, I'm like, I know I trust her, which is why I'm like doing it
Yep.
because otherwise there I wouldn't let anybody touch my mouth. So
Yeah, no, that's a big part of it too, right? It's like setting expectations, right? And then yeah, and then trust. And then
yes.
that's why we work right collaboratively with providers that we trust. And that's how I always gauge who, I work closely with is like would I send my family there? Would
Yeah.
I get treatment there?
Yeah.
100%, then we're good. If
Yeah.
not, let's continue to talk and grow and that's fine. But that's really, yeah, you hit it on the head. That's yeah.
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 Yeah. So, all right. So before we start to wrap up, because I know we could chat all day
I
long,
know.
just looking ahead a little bit, just tell everybody. I know that you're like on your calm certification track. You are maybe talking about beginning your CMT. You got your recent cert BBM. Like,
Yep.
what else do you have going on? Tell us a little bit about you.
Yeah, yeah. So lots of, we love to learn and that's what we're here for. And I love, every field is growing and changing. It doesn't matter what you're in, but that's why I really, staying up on the latest education. And that's why I love, right, the Myo membership. And really, once I, kind of finish up my com through IOM, I'll, start the next one, start with you and just get, continuing that growth and really just that I think it's helpful though for our clients, for our patients to know that like we are staying up with the latest education and that you will get, the best care that we can provide, that we always strive for the best and staying on top of things. And yeah, I finished up my certification in Buteyko breathing just this month. I think even a
Yay,
week or two
congrats.
ago recently. Yeah. Which is great because I've already been incorporating some breath work, but once again, kind of with that scope of practice and really being able to help clients from that way too, because breathing really is everything. It's even with what we do with Maya, with speech, with living, breath is everything. So I've been really excited about that one. And I'm looking to potentially doing some group breathing courses in a salt cave here in Charlotte.
Cool.
Stay tuned for the details there. We're kind of hammering that out in the back end, but that'll just be a different way to kind of incorporate some of that self care that we need, but really get the breath work that we need. And then I'll be speaking. I'm super honored. I have two big speaking engagements this fall. September, I'll be with the North Carolina Dental Hygiene Association in Raleigh. So I'll actually be speaking both days there, focusing on Myo. One, I'm going to do like a Myo kind of like overview, right, for newbies or people who aren't really sure about the airway. Do a lot more kind of case study focus, which I think will be neat. And then my second topic will be based on nutrition. So talking about what foods are great for the jaws and things like that. And then coming up in November, I'll be speaking with the Athena Dental with the Dental Holiday Symposium in Asheville, North Carolina. So and that will be more of a focus on like breath, breathing, and myo. So kind of, as we continue to get the groundwork awareness out. Now, when practitioners come to these events, we want to start to kind of dig a little bit deeper if we can, and then be able to spread the word on courses. And that's what I love. Everyone's like, okay, when I do these engagements, they're like, okay, so what courses should I take? And I'm like, Hallie's course, like
Oh,
start there. So it's a really
thank you.
great way though to set those foundations and then they can take it where they want. Once again, for me, most important is everybody being able to screen, right? You don't have to become a myofunctional therapist, you don't have to specialize, but to be aware of it is just my big platform that I won't get off of.
I love it. I love it. Well, thank you
Yeah.
so much for always referring. Much
Yes,
appreciated.
definitely, of course.
Yeah, we're obviously so honored that you joined us in the Myo membership. For many who listen, one of our longtime dental hygienist, mentors retired from like all things in
Yeah.
life, and we were so sad to see her go, but you're highly recommended. And when I saw, I was like, wait, I know Ashley.
Yeah.
Yes, like we've got to have her come in. And so it's really very cool to have you in there because, we do think it's so important for all of us to collaborate and to have that, that dental hygiene background in the myo space, along with like the SLP background and even the OT background
Yeah.
sometimes. And,
Yeah.
all just like work together because I feel like what's really cool. And I always tell people this is, back when I had my study club in Maryland, it was like 7 different practitioners in different spaces all sitting around a table looking at the same case. And it was just like, wow, we all bring such a different viewpoint to the table on the same patient. And if we could all just talk to each other and hear what each other is saying, like you've got the vision therapist, you've got the hygienist, you've got the speechy, you've got the OT, you've got the, oral surgeon, the ENT, whatever, right? You've got all these different practitioners all looking PT, even like looking at the same patient through a different lens.
Yes.
Even though we maybe have some similar training,
Yes.
we all have such different backgrounds that it was like, wow, okay, I didn't see it that way. But now that you've shared that information, that actually kind of shifts my treatment plan and like for this particular patient. So anyways, all that to say, I think the educational piece obviously is so super important. So I'm excited for you. I love that you're also speaking at all these upcoming speaking engagements. So people will get such good information, everything, airway, breathing and myo and nutrition. It's like marrying all of these topics together is like, you just don't get that in school, So it's cool that you are teaching it in a school setting
Yeah.
and you get to talk to,
Yes.
talk to people at different speaking engagements in the professional setting as well.
Yeah. Thanks. Yeah, it's just been, yeah, once again, full circle moment. Just so exciting to continue to educate and stay on top of everything and collaborate, right, with everyone because we all still have so much to learn, which I think is great. And that's where having like a safe, welcoming space to ask questions. No questions are dumb. Some
Yep.
okay, it's like, well, let's look and think about this. But no, we all see things differently. We're all unique, and I absolutely love the collaboration is key, and that's what's going to continue to make our clients healthier and just make our our world in general a better place. So all about it.
So true. Well, we'll have to keep us posted on you and your daughter's journeys. I can't
Yes.
wait to hear more about it. I know everyone can go follow you. So tell everybody where to find you before we wrap up.
Yep, totally. So Instagram is usually, the easiest social media. So we are Myo_movement. So that's MYO_MOVEMENT. You can also visit our website, www.myo-movement.com. We're also on Facebook. Yeah, those are pretty much the easiest way. You can call or text 980-999-1216. Bailey, our care coordinator, is incredible. So she's usually the first kind of person that you talk to when reaching out to our practice. But yeah, those are the best ways to connect.
Amazing. Well, Ashley, thank you so much for joining us. Thank you so much for your time. And obviously we'll see you inside the Myo membership.
But yeah, I can't wait for your journey to August 11th. So August is a big month. I love it. Love,
Yes,
love.
just wait. More
Yeah.
to come.
Thank you.
Quick disclaimer, all information, content, and material of this podcast are the opinions of the speakers and is for the informational purpose only and not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified healthcare provider. Thanks for listening to this podcast. If you found value in this episode and want to hear more of these MyoTots, airway, and feeding related episodes, be sure to leave a review on Apple Podcasts and share this episode on your social media platforms. You can access free resources and all I offer at HallieBulkin.com or pop over to @HallieBulkin on Instagram to get all the latest updates.